Hi, I'm Dr. Mark Scholz. Let's talk about prostate cancer. I want to talk to you a little bit about the medical chart. All the information that we're talking about in this video is contained in your medical records. There are 4 basic elements to how we stage prostate cancer. Those elements are the grade, which is determined by your biopsy, the Gleason grade, your PSA level, how the prostate feels when the doctor does a finger exam called the clinical stage, and lastly, any imaging studies. This information is compiled and synthesized through a quiz that's been developed by the Prostate Cancer Research Institute, which is available online at PCRI.org. But you will need to get the information from your medical chart about those 4 elements to be able to answer all the questions. When you're going through your medical chart to select the PSA, you want to pick the PSA that was done just prior to your prostate biopsy. PSA levels that have been done after your biopsy may be artificially elevated and therefore less accurate. The PSA can remain elevated for up to 60 days after a biopsy. Other things that can confuse the PSA are recent sexual activity within a couple days before you have your PSA blood test done. As men get older, some men produce less testosterone, less male hormone. That results in lower than expected PSA levels. So it's quite reasonable to ask your physician to do at least 1 testosterone level to ensure that you're in the normal range. With that, you can be sure that your PSA is an accurate representation of your status. The Gleason score is a grading system, of course, derived from the cells that were removed from your prostate during the biopsy. Those cells, depending on how they appear, will be graded lower or higher. A pathologist generates a pathology report, a piece of paper that goes into your chart. And in that report, it will assign a grade between 6 to 10, 6 being the lowest and 10 being the highest. Sometimes when you're going through your pathology report, you will notice that different biopsy specimens removed through the different needles will actually be assigned different Gleason scores. One may be a 7, another may be a 6. When you're entering the Gleason score into the PCRI staging quiz, you select the highest number as representative of your Gleason score. When you're looking through your chart to find where the doctor recorded the results of your clinical stage, that is the digital rectal exam, most likely you'll find it in a section labeled Progress Notes. This is where the doctor keeps all the written records of his examination and his discussions with you. Clinical stage T1C means that he didn't feel any hard spots. Clinical stage T2A means he feels a small spot that's hard, but only in one quadrant of the gland. Clinical stage T2B means that he felt a hard spot that was on only one side of the prostate, but it crossed both the upper and lower quadrants on that side. Anything higher is where the nodule passes over the midline on both sides, or if he feels anything outside the prostate. It'll be important for you to gather the information from the radiology section of your chart, where all the imaging results, MRIs, CAT scans, and bone scans, are recorded and compiled. The imaging studies, such as the bone scan, the CAT scan, MRIs, will all be reported out, and at the bottom, or somewhere within the report, there'll be a section labeled Impression. And this will summarize the findings of the imaging. Especially important, of course, is whether there's any metastases that have been demonstrated outside of the prostate, in the bones or in the lymph nodes. That information will be essential for the PCRI staging. The MRI, if you've had a multiparametric MRI of the prostate, will also record whether there's any invasion into the seminal vesicles or through the capsule of the prostate. So this information needs to be gleaned from the radiology section of the chart, where all the imaging reports are compiled. Surprisingly, Many patients are unfamiliar with what the medical record actually is. Your doctors have an official document that is HIPAA protected and records much of the important information that will be required for the PCRI staging quiz. That record is available to you. You can ask for a copy. Some doctors will request a minimal charge, maybe $25. It's very reasonable to ask for your records. Many patients ask for copies of their records. It's convenient for sharing with other physicians. It also allows you to understand your own case a lot better. So don't be bashful about asking for your records, and you certainly need to ask for a copy if you want to take the PCRI staging quiz. For more information, visit pcri.org/medical chart for further videos and more information about how you can access your clinical information. Thanks for watching. If you found this helpful, subscribe to our channel. You can also visit our website, pcri.org.